Hello everyone, and welcome back for part 3 of our series on lean healthcare. My name is James Marks, returning as your instructor for the series. Over the next 25 minutes or so, we'll be covering some of the lean tools and processes, specifically value stream mapping and the A3 problem-solving method. Some of our core objectives this session will be for everyone to have a basic understanding of the value stream map and the A3 problem-solving method. We'll also be having several experiential learning cycle activities that include creating one of each. In this session, we will have a couple of activities. You'll need 2 to 4 pieces of paper and a pen, pencil, or some other writing implement. The first step in understanding value and creating an effective value stream map is understanding states. In Lean, there are 3 primary states under inspection: a current state, an ideal state, and a future state. The current state outlines a process with all of its waste and defects as it exists today. The ideal state is a vision for what a waste-free process would look like. Many times, the ideal state is not attainable due to regulatory issues, reimbursement issues, safety issues, or other requirements that justifiably prevent complete efficiency. The ideal state is free from defects, is the ideal process, and is safe for the patient. Future state is not the ideal state. As we've discussed all along, Lean is about continuous and incremental improvements. Future state takes us from one or more steps closer to the ideal state. Once the improvement has been implemented, the future state will become the new current state. The ideal process is defect-free. This means that the process delivers exactly what the patient needs when they need it. Not more, not less. On demand, one by one, customized for each and every patient. Not more or less indicates what we have been talking about all along up to this point: zero waste. Most importantly, the entire process is free from harm, whether that harm is physical, emotional, or professional, to the patient. So how do we visualize this? We use a tool called value stream mapping. A value stream map is a visual tool for deployers of Lean. The value stream map is a graphical map that shows all of the steps in a process, but this map is different than the standard process workflow, which outlines steps in numerical order from an objectives perspective. The value stream map is from the perspective of the patient and what adds value for them in a process, as we covered previously. The value stream map starts with a patient's request for something and ends with the completion of their request. The second step in this method, mapping out the process under inspection, both in the current state and in the future state. The first goal of this step is to map out how does the work flow now. This is the question that defines our current state. A good practitioner of Lean will understand and map out the current state by getting out into the Gemba. Gemba is a Japanese term that means where the real work happens. Or, to put it simpler, current state is mapped through direct observation of the process. Many times managers of processes have a lot of assumptions about how things should be done or how they think things are actually being done. And more often than not, we'll find out that things occur much differently upon direct observation. A key tenet of a current state value stream map is that waste is identified and called out in a thundercloud-like image called a sunburst. These are the areas of inspection process improvement initiatives will focus on, eliminating these wastes and maximizing the value for the patients. This is an example of a current state value stream map. The flow of a value stream map is not immediately intuitive. The process starts in the upper right-hand corner box with the patient's request. In this example, the patient is in a hospital bed in need of meds. In this example, there are 2 possible triggers represented by boxes for the nurses in the north, the top box, and the south, the bottom box. The flow goes through to the left side of the patient and through the chart, ending with a request. and triggering the beginning of the fulfillment of this request. Throughout the process, you can now see waste called out very clearly in red starbursts, indicating many different types of wastes, and red triangles indicating waiting time waste in particular. As you can see, the process for a patient to request meds and receive meds at this facility is very convoluted and full of waste. Here we see two ideal states. The most ideal state is that a patient makes a request for meds to the vendor and the vendor responds immediately. However, we have laws, rules, regulations, and safety concerns. A patient cannot request their own IV bag in most situations and require a doctor to prescribe an administration of IV fluid meds. In our regulatory environment and for the safety of the patient, the second option is the most ideal state. So, how do we get from our current state to this ideal state? Through incremental improvement initiatives over time. This is one of many possible future states. You'll immediately notice that everything looks much cleaner. There's much fewer steps involved. Most of the red waste starbursts have been replaced with efficient blue skies, in this case clouds. 27 process steps in our value stream current state map was reduced to nearly 16 steps over the course of several process improvement initiatives. Now, one of the moments we've been building towards over our 3 sessions. Over the last several weeks, you should have identified at least one of the 8 forms of waste in one of your work processes. Now, we put into action by applying our value stream map to them to see where they are and other forms of waste as it falls into our daily work. Over the next 5 minutes, draft out your process with the waste you've identified, creating rough current state map with your waste you've identified called out in starbursts. Okay, pencils down. So, what did you find in your review? Did you find any other forms of waste pop up as you were going through and drawing your value stream map diagram? It's important to think critically and creatively when you're identifying waste. Always think about it from the perspective of the patient. What does not add value from them? Think of yourself as a patient. As you're sitting in the waiting room, waiting for a lab to be performed, waiting for an x-ray to be performed, waiting for a doctor, any type of waste you want to look at critically in your processes and call them out with sunbursts in your value stream map. Those will be the targets that we will look after in the coming section. Now, with your value stream map, with all the waste identified, diagrammed out, we're now ready to move on to our process improvement, the A3 problem-solving method. This is the A3. If you were to look at your printer settings, A3 is simply just a format of paper. Specifically, it is the 11-inch by 17-inch paper format, otherwise known as tabloid. But we've added quite a few elements onto this, and this is what lean practitioners use when they are going through a process improvement initiative. Section 1 and 2 of the A3 are the issue and background, collectively comprise the problem statement. They should be in regular language narrative format so that anyone can pick up the form and know the nature of the problem. It should include a start date if there is one, any other relevant conditions. It should be measurable, and this is important for later purposes. It should describe an observable current condition. Another important note is that a single A3 should not try to solve all of the world's problems today. Remember, we're targeting small incremental improvements. Keep it simple. Focus on one improvement at a time. In some instances, a single improvement may even be spread out over multiple A3s. A good goal is to have a single A3 being able to be completed within 1 to 3 weeks. This is a good example of a problem statement that, in the lab, that may read something like this. Phlebotomy draws by nursing staff often result in the wrong tube being used. The problem started about 6 months ago when the laboratory issued 4 different reference guides and did not include photos. This has resulted in redraws of 25% and an increase in turnaround time by 50%. It's important to note here that how you word your problem statement is important. The way you use your words, the way you construct your sentence in your problem statement can change, sometimes drastically, the focus of the A3, so choose your words wisely. Once you're done defining the problem statement, the focus turns to the current condition. Several sections of the A3, this one included, are highly visual. We are visual learners, and seeing how something is done is just as important as understanding the physical steps. The current condition section is a visual section that can include drawings, charts, or some other visual implement. To the extent possible, you should try to avoid using data, tables, in anything that is of a technical nature. Data that is visualized with graphs, histograms, and pie charts are used, granted, but the point here is that we need to focus on what the patient sees. They do not see data. They see somebody walking down the hall. They see the laboratory processing their samples. Step 3 in our A3 problem-solving method is the root cause analysis. Lean employs a 5 whys analysis method. The 5 whys is a simple task that requires the Lean student to ask why 5 times. Take our problem statement with the nursing and using the wrong tubes. Question: why are they taking the wrong tube? Answer: they were confused about which tube was correct. That was why number 1. Why number 2? Why were they confused? They could not find the answer in the lab guide. Why number 3? Why couldn't they find it? They stopped looking after 5 minutes. Why did they stop? They did not have time to look in all 4 references. Why are there 4 reference guides? Well, is this our root cause? Do we stop here? The point of the 5 whys is not to set an arbitrary number that we must religiously adhere to. The point is the fact that it is a mechanism to force the lean practitioner to continue to ask questions beyond what we may believe is the root cause initially. Oftentimes, we stop our inquiry early and solve the wrong problem. In this instance, if we stop at question 1 or 2, we would create a solution that does not solve our root problem. Our future state would still have defects built within it, and that is what we are trying to avoid. If you need to go to 6 questions, 7 questions, 8 questions, do so. If you find your root cause at question 3, that's great, excellent. But don't stop at 3. Ask 4 if there is one. If there isn't, you've done your due diligence. Moving to step 4, we'll begin to define visually what we want our process to look like. This is otherwise known as the target condition. Along the way, we will create countermeasures that help a particular process improvement to stay the course. Like the current condition, the target condition is a visual representation that may represent ideal state, not necessarily the future state. The aim is, simply, to eliminate the waste we've identified to include any workarounds or rework. Countermeasures are some of the incremental steps or measures we put in place to get us closer to the ideal state. There are a large part of the future state we are trying to strive towards, and they address the root cause of our specific waste under inspection. It may require multiple A3s and multiple future states to get to an ideal condition state, but we should spell them out visually. Going back to our phlebotomy example, some countermeasures could include consolidating the reference guides, moving away from 4 down to say 2 or 1. Alternatively, we could make the guides more intuitive. Adding visuals may increase their penetration and ease of use. Now, using our value stream map we've made, let's draft out our first A3. Grab a piece of paper and a pencil. If you have a printer, you can print out the slide with the A3 example supplied in this slide deck. Otherwise, you can draw it out very quickly on paper. You should have on hand. Take the next 5 minutes or so to draft out your A3 that accurately describes the issue, visualizes the current state and ideal state of the problem under inspection, and categorically spells out the countermeasures that will incrementally improve the waste over time. Feel free to pause the video at any time if you need a little bit of extra time. Okay, pencils down. So, what do you think? Were you able to find the most ideal state from the patient's perspective? Would they look at your process and think that there is no one that could do it better? Could Amazon or Google do it better? How would they do it? Would they use perhaps technology or some other innovative or novel mechanism to improve your process? What about people and attitudes? Could they make it better? These are all questions that we need to ask ourselves when we're going through and developing an A3. From the perspective of the patient, is our ideal state truly ideal? Does our next step, our countermeasures towards reaching the next future state, is it achievable? Can we do it within a short time frame? Can we have cyclical improvement over time? Thank you again so much. I truly appreciate your time. Please send me your feedback directly. You should have my email address. If not, feel free to reach out. I really value your feedback so that I can make this presentation and my presentation skills better over time, just like Lean. I truly hope that the presentations and the sessions that we've had up to this point have been beneficial for you and your clinic. And please feel free to reach out if you have any questions on what the next steps could be implementing Lean in your office.